Good afternoon and welcome to the COVID-19 update on Channels Television, a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. First, some of the highlights. Today, confirmed cases of COVID-19 in Nigeria nears 1,000 mark. Nigeria Labour Congress gives conditions for lockdown extension. And world's Muslims face Ramadan under lockdown. Are set for the annual Ramadan, but as they do that, here's some advice from the Presidential Task Force on COVID-19 and the Nigeria Center for Disease Control, NCDC, and that is you should practice good sanitary hygiene, physical distancing, stay home, and stay safe. Its figures from the NCDC indicates that the coronavirus in Nigeria is nearing the 1,000 mark after confirming 108 cases of COVID-19 yesterday. Of the 108, 78 cases are in Lagos, 14 in Abuja, 5 in Ogun, 4 in Gombe, 3 in Borno, 2 in Akwa Ibom, 1 each in Kwara and Plateau states. This brings to 981 the total number of confirmed cases in Nigeria, with 197 discharged, 31 deaths recorded. A look at a state-by breakdown of the cases across states shows that Lagos has 582, Abuja 133, Kano has 73 cases, Ogun 29, Osun 20, Oyo and Edo 17, Borno 12, Kwara, Akwa Ibom 11 each, Kaduna and Gombe 6, 9, Bauchi 8, Delta 6, Ekiti 4, Ondo Rivers have each, while Jigawa, Enugu, Niger and Abia states have 2 cases each. Benue, Anambra, Sokoto, Adamawa and Plateau all have 1 cases each. In the meantime, President Muhammadu Buhari is cautioning against actions that can spread coronavirus as Muslims in Nigeria join their counterparts around the world to welcome the Ramadan fasting period. Congratulating Muslim faithful, he expresses that this year's Ramadan is a big challenge as it is coming at a period of the global pandemic. The president advises all to avoid large gatherings and should try to have their prayers and meals individually or with their family at home. The Plateau State Governor has called for calm after the state recorded its first case on Thursday. According to the Commissioner for Health, Dr. Ninkong Ndam, the COVID-19 test was conducted on 1 person who came into Jos from Kano State on the 17th of April and has been on quarantine since his arrival, while contact tracing has since commenced. The Plateau State government is also calling on citizens to be vigilant and report any suspicious case while assisting government to enforce border closure directive. The president of the Nigeria Labour Congress, NLC, Mr. Ayuba Waba, insists that the lockdown by the proposed state governors will not be supported unless workers get sufficient palliatives from the authorities. Mr. Waba, who is a guest on our breakfast program, Sunrise Daily, also warns the government not to trample on the rights of the Nigerian workers this period.
We now wrote about 13-page document to try to advise on what needs to be done, because one, it's not only about treatment, control, and then prevention. It's also about how do we strike a balance in making sure also that the economy doesn't suffer. Because when you look at the global picture, and even the picture here at home, looking at the economic indices, is the fact that there is a lot of challenges, and the prospect is very gloom. So clearly, all those submissions we made, which are about 14-fold, also borders on the issue of the fact that beyond treatment, because part of the challenge of the coronavirus is, one, the issue of mobility and mortality, but the most important and very pronounced issue is also that all lines of production have been affected, and particularly those in the informal sector. And what we wrote in that document and what we have also discussed is the fact that we must be able to strike a balance at this point in time. If you are going to extend, then there are things you must put in place, especially palliative, that must reach the poor of the poor, because at the end of the day, you may make pronouncements, but if there are no conditions, precedents that have been set that people can also try to conform with, at the end of the day, those pronouncements will be violated. And we don't want that to happen. And therefore, we gave clear picture of what needs to be done, particularly the palliative. We said that the current use of the social investment platform have not delivered the desired results, and therefore is a template that is not supposed to be used. We gave a proposal to say that we can't look at other models because this is an emerging issue, and therefore we need to take care of the poor of the poorest, particularly those that cannot have a meal per day.
Residents of Lagos State have been asked to disregard a list making the rounds on social media of hospitals and health facilities purportedly exposed to COVID-19 cases in the state. The Executive Secretary, Lagos Health Facility and Accreditation Agency, says they did not give any advisory to the public not to patronize certain facilities in the state. The ministry explains that some health facilities might admit or treat patients with COVID-19 without knowing, and if this happens, the facility will be temporarily closed for decontamination, while the staff would be trained on infection prevention and control, after which the facility is safe to carry on its normal operations. They also appeal to members of the public to desist from stigmatizing health facilities that might have been exposed to COVID-19 cases, as well as patients infected with the disease, to prevent severe health problems. Joining us on the program via Skype is Dr. Deji Olaleye, a physician intensivist with the NHS, Essex, United Kingdom. Thank you for joining us at this time. First, tell us how the past weeks of lockdown has been for you.
Thank you, Millicent. The past few weeks have been challenging, no doubt. There's definitely been diminished social and physical interaction, and of course, for many people, the challenge is the fact that they cannot engage in recreational activities as they would have loved to do. So it is definitely challenging for everyone.
We're hearing that social distancing might be extended till the end of the year.
Yes, I think that the plan, from what it seems at the moment, is sort of phased of this. Phase depends on how important are certain.
Oh dear, Dr. Olaleye, for some reason we appear to be losing you. We'll try to connect again with you, but let's continue here. States across Nigeria continuing to work out measures to curbing the spread of COVID-19 and also ease the hardships following the lockdown. The recent confirmation of 2 index cases of COVID-19 in Abia State is a source of concern to the government, its citizens, while some residents complain of economic crunch, hinting that the government palliatives is not enough, as well as the lack of power, which may hinder the ongoing education online. The government says it won't condone people disregarding the sit-at-home order while it works round the clock to keep Abians safe from the virus and limit the spread. Now let's move over to Cross River State, where the government is calling on the federal government of Nigeria to support the state in ensuring that its borders remain closed to avoid the spread of COVID-19. According to the governor, it is worrisome that even those under essential duties initially given passive entry are at risk of contracting and possibly spreading the disease, except proper medical procedures are followed. Let's go over to Kaduna, where the state government has set up mobile courts to summarily try curfew violators in its efforts to preserve public safety. The decision was taken by the State Executive Council to enforce the executive order following a lockdown order in place throughout the state March 26. The Kaduna State government has also threatened to sanction traditional leaders of communities where such violations take place. Now, Governor Aminu Masari of Katsina State has directed the lockdown of Safana local government area of the state effective Saturday morning. The directive is coming after the confirmation of 3 more coronavirus infections in the affected area. A report by the NCDC shows that all the 3 cases were primary contacts of an index case established in Dutsima local government area. And following the announcement by the Sultan of Sokoto on sighting of the moon for the month of Ramadan, Sakin Kano Alhaji Aminu Adobayero has asked the people of Kano State to comply with the directives of the apex religious body of the Sultan Palace to commence the compulsory fasting for the month of Ramadan. Amidst the COVID-19 pandemic, Sakin Kano wants residents to use the holy month and seek God's intervention in bringing to an end this outbreak. And as Muslim faithfuls begin the annual fasting across the globe, Lagos residents have been warned to continue to maintain physical distancing and comply with other directives meant to curb the spread of the virus. The Commissioner of Police, Hakeem Odumusu, however, asks clerics to be more exemplary in their lifestyle of leadership by assisting security operatives to effect the directives.
We have been enforcing that, and I must confess and I must praise. So the religious leaders and their followers, both Islamic and Christian way. So unlike initially where we had some, how will I call it? So some altercations with them. Now they realize that it's real. Most mosques now, they no longer have mass prayers. And churches too, they no longer have Sunday prayers, which means that they are already imbibing this. So what the Sultan did is just to reiterate this and let them know that this thing is real and we must continue to maintain social distance in order to make the virus not spreading more. We in our part now, as we've been doing since we started this, we have been going on persuasive enforcement. In fasting is another way of checkmating ourselves from all evil or bad actions or activities. So it's going to go a long way in further curbing the spread of the virus. So it's why would I call it something good coming out of something bad? Because the fasting coming now with the coronavirus, and there's been in before the fasting comes in now. So the fasting is going to assist reducing the spread of the virus.
Staying home and staying safe. Well, for more on, indeed, the strategies to flattening the curve and the rising cases, joining us in our Lagos studio is Dr. Kayode Adebayo, former Nigerian Medical Association Chairman, Lagos Chapter. Glad to have you on the program.
Good afternoon.
All right. Now, we've had you, and this was the earlier cases that we were seeing in Nigeria, and now we're hitting the 1,000 mark. How do you feel?
Feel very bad, but obviously, it is not, we expected it. Nigeria has enough time to plan for this scenario.
I think we have or we had?
We had, because this case started in other countries and we saw that it actually paralyzed all the healthcare system, despite the fact that they have better healthcare system than Nigeria. The most alarming part of this scenario now is, if you look at it very well, the rate at which the healthcare professionals are getting infected is alarming. Government is trying, there is no doubt about it. But there are some areas we need to look into critically. Most of the cases we have so far were referrals from private hospitals. In most cases, some of these doctors are not even aware there could likely to be a case of coronavirus infection. Now, when they had a suspicion that, this could be a case of coronavirus infection, they called for test. They called the Center for Disease Control for test. It takes another 2 days.
In the same states, like Lagos?
It takes another 2 days before the test could be done. In most cases. Then results take another 2 or 3 days. Now, during this period, where is the patient? The patient is still in the private hospital. And as a physicians and other healthcare workers, you have to manage patient. Patient has respiratory distress, patient needs oxygen, patient needs this. You can't abandon the patient to die as long as it's still in your facility. So imagine a situation where a patient with the coronavirus infection is staying 4, 5, 6 days in a facility. Of course, we are not surprised that the doctors and the nurses and other are getting infected.
Dr. Diboye, we'll come back to you. Please stay with us. We need to go on a break. More on the COVID-19 pandemic when we return. Welcome back to the program. We've been talking to Dr. Kayode Adebayo, former NMA chairman, Lagos chapter. Thank you so much for your patience. You were talking about how susceptible healthcare workers are in Lagos, and you mentioned it takes about 4 days before they get a result from the NCDC confirming a positive or negative status of a patient. But shouldn't they take any patient coming in as a suspected COVID-19 case and then prepare, protecting themselves?
Yeah. Yes, but there are deficits in the system for now. About 70% of patients, we patronize the private practitioner first. And when you look at the current arrangement, the private practitioners are not fully carried along. A private practitioner does not have PP, does not have an isolation center in his clinic. Some run 3-4 bedroom, even those that have a bigger facilities, because we've not faced a situation like this before. There's no provision for, we could have a very contagious disease that we need to have a separate place, we should have a PP. Then they are not even trained in that direction. You see, don't compare the private sector with isolation center. Isolation center is prepared for it.
Well, the Presidential Task Force has talked about accrediting private hospitals, private facilities for this.
Well, we are not aware of, maybe when the government published the list of private centers that are accredited, well, we know. But you see, generally, when we look at all the cases we have seen so far, they are from private clinics. And in a situation, this is a war's time. We should see it as a war. If we see it as a war, we need to get all the soldiers ready. If we say, okay, the doctor, protect yourself, the nurses, protect yourself. No, it's like telling a soldier that go and train yourself to face this war. No. The health regulatory system, the private hospital regulatory system, the pharma, they know all the private hospitals. They should get them along. In each of the local government, we need a center, a temporary isolation center, where we can evacuate these suspected cases from private clinic, where, pending the time we get the result, and evacuate them to the treatment center. If you keep keeping them in a private sector for 3, 4, 5 days, you are increasing this community infection. Here we have doctors and nurses, after treating the patient, go back to their houses. Whereas in the proper isolation centers, these healthcare professionals stay at the centers. So you have limited them from having contact with the people in the society. But a nurse that is exposed to an infection, enter a public bus, get to the house, mix with the children. We need to have an isolation center in each of the local government so that we can mop up this patient as fast as possible.
We understand that we have Dr. Deji Olaleye, a physician back on from Essex in the United Kingdom. Hope you can hear me now. Just to quickly get your point of view with regards to what health workers are going through in the United Kingdom in fighting the pandemic. In Nigeria, we're having over 40 healthcare workers who are positive with the virus. What's the situation there?
Well, thank you for having me once again. It's a similar situation, I'm afraid. We also have a fair number of health workers who have been infected, and some, unfortunately, quite a number actually, have died as a result of the COVID-19 disease. So I think it's just that the health workers will be significantly exposed, and there will be repeated exposure as long as you look after these patients. It's an unfortunate consequence of the epidemic itself.
Leader Sir Starmer said that the frontline workers are scared to work.
Well, these are unprecedented times. Many of us have not faced an epidemic or any disease of this magnitude before, where in addition to looking after someone who is significantly unwell, you face the risk of getting such an infection yourself. So I think a certain level of fear and anxiety will be there, and some of it is indeed healthy because it keeps you on your toes. But I want to believe that most of the people that I've seen, in spite of the fear, in spite of the anxiety, they are giving their best to the situation.
Do you think that perhaps if we extended the lockdown nationwide, interstate, that this would help prevent what we're witnessing, and that is the community transmission in Nigeria?
Well, you see, I think we should understand in Nigeria that we do have limited options, unfortunately. We have limited strategies. This is because of our limited healthcare infrastructure, the fact that we don't have the sort of ventilators, we don't have the novel therapies that are being tried to treat this disease. So our surest strategy, the most thing that we can do most aggressively to sort of fight this disease is definitely lockdown, enforcing social distancing. So I think probably we are 2 weeks behind. Maybe if we have suddenly enforced that nationwide lockdown earlier, perhaps the sharp rise we've seen over the past few days, we will not be having it now.
Okay, our guest also here mentioned the same thing, meaning that we shouldn't have taken the WHO's advisory to locking down as early as when the US did a lockdown, but yet they're the highest number of confirmed cases in the world.
Exactly. If we have done a lockdown much earlier, we could have gotten a better result. We would have been able to limit the community infection. You see, as it is now, there is war on ground. And what we are seeing now is just the preliminary phase of the war. You remember when Italy, New York were having less than 300, less than 400? We thought, nobody knew that the situation will be that bad. Now, sometimes ago, we're having 3, 4, no zero deaths for like 10, 12 days. But look at it now. The more we have cases now, if you look at the curve is really facing up now. So also the death rate is facing up. So now, this is the best time to tell ourselves now that really, really we have a big war at hand.
Right.
And at this war, that's what I'm saying. We need to get both the private and the public involved.
Right.
It is not a job we leave for general hospital or we leave for government hospital alone. No!
We appreciate your time, Dr. Kayode Adebayo, former NMA Chairman, Lagos Chapter. Thank you for joining us. Let's go back to Dr. Deji Olaleye in the UK. And this is, with regards to what we're seeing here in Nigeria. It's a vulnerable situation, essentially. But then how do you think perhaps that we can look at other measures we're taking, like disinfecting, decontaminating several other areas? Is this something that's also going on in the UK? We see several other parts of the world are trying to open up. Even South Africa, with its numbers, are also saying that they might be opening up businesses a little bit from May the 1st. What do you think?
Yeah, I think the timeline of the epidemic, depending on which stage, which country is in, there's a certain point you get to when it probably seems that the cases are starting to decline. And that would show that 2 weeks earlier, there was a decline in the level of community transmission. So if you work with that, you can possibly predict, then going forward to say at a certain point in time, we can start to lift up the lockdown in phases. And what I mean by in phases is that the more essential services, the more essential activities are allowed to start, and there'll be a gradual return to life as normal as possible. I think it's a worthwhile strategy if you are at that point in the timeline of the epidemic. But before that point, it would not be a good idea.
All right, we appreciate your time. Dr. Deji Olaleye, physician with the NHS Essex London. Thank you for joining us.
Thank you.
The coronavirus pandemic has disturbed the rituals and traditions of the vast majority of Islam's 1.8 billion adherents, who will abstain from food and water during daylight hours for the next 30 days. In most countries, mosques are closed, and Ramadan's traditional evening call to prayer will be heeded only at home as Muslims experience the holy month under lockdown.
Muslims across the world are today marking the start of the holy month of Ramadan, and many of them are doing so under lockdown. Although some countries like Pakistan and Indonesia are allowing events to go ahead, for many people, social distancing measures mean traditions can't take place as usual this year, with people unable to pray at mosque or even gather for meals. More than 191,000 people have died due to the coronavirus pandemic, with 2.7 million infected globally. The United States has suffered one of the deadliest days of the pandemic, with 3,332 fatalities in 24 hours.
The Nigeria Center for Disease Control and the World Health Organization have public health advisories on what you need to do. The combination social distancing, hand washing, cleaning of surfaces regularly has all the information, statistics, all you need to know about the pandemic. That's how we wrap things up this afternoon. Join us again at 6 p.m. for another update. I'm Millicent Wonwoka. Bye for now.